Sorry will not cure it though, but sorry can reduce the anger. What infuriates patients most times is attitude, not necessarily what was done. Can you quantify the reputational damage that would have done to the hospital?
From a community development perspective, when we talk about patient safety contributes directly to economic growth and productivity. Healthy individuals are better able to work, are better able to learn, are better able to contribute meaningfully to their communities, which we can also tie to the popular saying that health indeed is wealth. In the same vein, patient safety is also closely linked to health equity, social justice, and it's important that communities have strong patient safety policies. This is to ensure that all individuals, regardless of age, regardless of gender, income, or location, are able to receive quality and respectful care. Now, joining us on Data Chat this evening, to share insights and just talk around the conversation of patient safety, we have in the studio Barrister Ebenezer Igwatu. He is a medical lawyer and a patient's rights and safety advocate. You're welcome to the program this evening.
Thank you. Good evening, listeners.
Okay, so before we start the conversation, let's just have a quick run through the poll findings. Let's hear what the poll is saying so that people who are listening can also have a feel. And to do that, we have Debe, who is the research associate with NOIPolls, run us through the poll findings. Over to you, Debe.
Results from the recently conducted nationwide poll on patient safety reveals that almost half, that is 43%, of our adult population disclosed that they witnessed a medical error or a near-miss incident in a healthcare setting. A slightly higher proportion of males, that's 46%, to females, 39%, admitted this. About 1 in 4, that is 24% of adult Nigerians, rated poorly the effectiveness of communication between healthcare providers and patients, highlighting plausible reasons for medical negligence. Whereas 1 in 2, that's 50%, rated the quality of effective communications between healthcare providers and patients as good. Furthermore, 73% consider that healthcare organizations prioritize patient safety, whereas 21%, that's 1 in 5, believe healthcare organizations do not. When asked what the most critical area for improvement in patient safety is, results show that 19% of adult Nigerians indicated medication safety, 18% highlighted better staffing. Other notable mentions were 9% who mentioned timely care, 8% who mentioned enhanced monitoring, and 7% who mentioned supply better equipment for diagnosis, among others. These are highlights of findings from the recently conducted patient safety poll. It's back to you in the studio.
All right, thank you very much, Debe. Okay, so let me come to you, Mr. Ebenezer. Understanding patient safety is critical because even minor errors can have serious consequences, some of which we've seen from the poll. To begin, how would you define patient safety and why is it such a crucial issue within the healthcare sector today?
Okay, thank you very much. Firstly, for putting this crucial topic together. Patient safety basically is efforts made by hospitals, made by healthcare institutions to reduce medical harm to the barest minimum. So when patients come to hospital, they are not expected to suffer harm. If you talk medical ethics generally, the core principles, one is principle of do no harm, the principle of non-malfeasance. So a healthcare professional is not supposed to deliberately cause harm to a patient. So in summary, patient safety is simply steps taken by healthcare facilities to minimize, reduce to the barest minimum harm to a patient. Now, this harm could come through medication error, it could come through misdiagnosis, it could come through hospital-associated infections, it could come through surgical error. So anything that will bring harm to the patients, efforts made by the healthcare facility and protocols put in place to checkmate and reduce that harm is what we would call patient safety.
Okay, so from the poll, we see a significant proportion, 43%, reported that they have experienced or witnessed medical error or a near-miss incident. Medical negligence is often misunderstood. And from what you've highlighted, would you say those actually fall within, the definition of medical negligence? What constitutes medical negligence, and how does it affect patients and families?
Okay, now medical negligence, for a layman's understanding, is simply the failure of a healthcare personnel to utilize or exercise reasonable skill and care of a professional of his standing in taking care of a patient. I'm going to put it in another way. Medical negligence is the failure of a healthcare personnel, be it doctor, be it nurse, be it a lab technician, to do what he ought to do or what he ought to have done in a given care service scenario, which is the standard practice. Meaning, if you took that scenario to India, the standard practice would have been the same. If you took it to US, it would have been the same. Where the personnel in question now fails to do it in the same circumstance, the person will be adjudged to have been negligent on one hand. The converse of it is now doing what you are supposed not to do in taking care of a patient. So basically it is mistake. But when you talk about the components or ingredients of medical negligence, before we can ground a claim of medical negligence in courts, firstly, the patient has to establish that there is a duty of care. There's a relationship between you and the doctor. There is a contract of medical service, whether written or inferred, that this doctor is supposed to provide medical service for me. So because you are a medical doctor doesn't mean somebody can just walk up to you and hold you liable for negligence. So there is supposed to be, firstly, duty of care, that I registered in this hospital, that I contacted this doctor, that even over the phone we had an understanding that he is supposed to provide medical care for me. Once you have established duty of care, the next thing you are supposed to establish is that this duty of care this doctor owes me was breached by the doctor. That the doctor did not do what he's supposed to have done in the course of taking care of me. So he didn't exercise what I said earlier, reasonable skill and care of a medical personnel of his standing. Now that is important because you do not expect the same reasonable skill and care of a consultant from a resident doctor. There are two different, a consultant of maybe 30, 40, 50 years. The standard of care, expertise rather, expected of him is higher. You also do not expect the same standard of care from a specialist as opposed to someone who is a general practitioner. Then, thirdly, you need to prove that you have suffered harm. So we've talked about duty of care, we've talked about breach of duty. Now, that you have suffered harm is very important. So you may not be able to grant a negligence claim where there is no harm. An error has occurred, agreed. There is a duty of care, there is breach of duty. But what harm did you suffer as a result of that breach? Because when you are claiming damages, we are saying where there is wrong, there is remedy. Which should be remedied. So, where you have not suffered harm, this is very important. You may not be able, I didn't say you will not, I said you may not be able to grant a claim. Duty of care, breach of duty, harm. Then lastly, causation. You have to link that harm you have suffered to the breach. The fact that you suffered, what if you were just passing, slipped and fell and broke your ankle? Would you hold the doctor liable even though it happened in a hospital environment? Now, to a certain extent, if we begin to talk about other rights of a patient, That's a different thing, but certainly not medical negligence. That can come in that the doctor failed to provide safe and secured healthcare environment. It's a different breach, but not negligence. So if we are talking negligence, there has to be a direct link between the harm you suffered and the breach of duty by the healthcare professional. That is where you now have, that's where you can succeed in your claim for medical negligence.
Common causes of medical errors include poor communication, that can play a role, fatigue among healthcare professionals, and inadequate systems, more like understaffing as well, and failure to follow established protocols within the healthcare facility. What, from your experience, what are the most common communication gaps between healthcare providers and patients?
Okay, let's start it this way, that communication, you may call it, but if we talk about rights now, we say that the patient has a right to information. So communication is not just about sharing knowledge or informing the patient. It's actually a right, and there are legal consequences where where communication gap leads to medical error or causes harm to the patient. Now, if you look at section 23 of the National Health Act, it makes right to information a cardinal right of the patient. What constitutes this right? Firstly, a patient has a right to know the nature of the ailment he is suffering from. Secondly, he has a right to know the cost implication, the treatment options available, not just the treatment option your facility can provide. If there are 4 different treatment options, he has a right to know. He has a right to know the cost implication of these treatment options. He has a right to decline that treatment at all. He has a right to say, okay, I've heard you, out of these 4 options, I do not want any. He has a right also to know, this is where communication comes in. He has a right to know the likely or probable side effects of each treatment option. You can say, madam, if we administer this injection, one of the probable side effects is that you are likely to go deaf on one or both ears. The patient knows. You are likely to have your sight affected. The patient knows. If we administer this injection, you are likely to become dizzy, or in fact, you will become dizzy. That's one of the side effects. So once we administer this injection, do not drive. You see that? So that, assuming the woman was not informed, and she takes that injection, jumps into the steering, and starts driving home, and has an accident on the way. We may not, in fact, we will never trace it to communication gap between her and whoever attended to her at the hospital. So communication is very key. Now, the law makes it easier that as much as possible, such information should be provided for the patient in the language the patient understands. Meaning that if my aged grandmother who does not speak English comes to a hospital, you do not use your medical jargon or terminologies to, okay, let's say a woman presents for cancer. After you have done all your diagnosis, it's cancer. The facts are correct. But you now say, madam, what we've discovered, you have stage 4 cancer which has metastasized. Does the woman know the meaning? She's not your medical colleague. So you bring it down. Now, communicate the way you relay that information is also very important. No, cancer is no good news to any human being. So you don't just come and say, madam, yes, we have seen that you have stage 4 cancer. Anyway, there is nothing we can do. We can only manage it. The woman might get home tomorrow morning, that night, and refuse to wake up the following morning. She will just die. But if you say, madam, we have seen your results, you have cancer, stage 4. We will see and support you. It can be managed. It's the same thing you have said, but now you are giving hope. In fact, there is even a model for sharing bad news to patients, you don't just come and say, sorry, we did our best. There's nothing we can do. We lost the baby. On the hallway, as you are walking out of the theater, as a doctor, you don't do that. We understand that a lot of factors will affect communication, but primarily it's lack of training, lack of basic communication. Here is not ability to speak English. When we talk healthcare communication, it's not ability to speak grammar. Yes, we are saying that, okay, if you use the spike model, for example, the spikes model, S says you look at your setting. So here now, the other patients here, the other patients' relatives here, you want to break bad news. A husband has just lost his wife. They are not up to 2 years in marriage. Then you come to the crowd. Sorry, sir, where is the gentleman whose wife was in labor? Okay, are you the one? Sorry, we are sorry to inform you, we just lost her. It's the same information, but your setting is wrong. So you seek privacy. Get the right setting. Then PDL, you get his perspective. Let's assume now that it's a wrong or a sad diagnosis. Let's look at our cancer example earlier. You can ask the person, what do you understand by this result? You want to get his idea, his understanding. What do you understand by this result? You have prostate cancer. What do you understand? You are looking for his perspective. So if he doesn't, of course, he will not have a wholesome understanding. That's why you are the professional. So you guide him, you correct, because he's coming with a lot of myths. If you open Facebook, you see everybody talking whatever the person likes or about any ailment. Everybody now is a healthcare professional, which ought not to be. So the guy is coming with some cultural myths, he's coming with some religious myths, he's coming with different kind of things. So you find out his perspective. What do you understand by this? The person says, doctor, does it mean I will no longer be able to procreate? That's the perspective he's coming with. You correct that. You allay a lot of things. Then we go to I. You invite him, invitation. You want to share knowledge. How much do you want me to tell you about this result? Some people will say, tell me everything. Or die and I die. Some will say something must kill a man. But another person will say, no, just tell me. I'm not in a good state to even hear anything now. Let me just go and prepare myself and come back. You owe him that right to allow him, because he doesn't have the right frame of mind. So if he says share, then you go into details. But you are not sharing it with despair. There's nothing we can do to help. Then we've talked about invitation now. Then your K is your knowledge. You now bring the right information to him. E is your empathy. Like I said, it's not about throwing information. The person you are talking to is a human being with emotions, with family, with job, with life at stake, with aspiration. So how do you communicate this bad news with so much empathy? In fact, many years ago, over 10, 15 years ago, I witnessed a scenario. I was in the hospital ward. I was nursing my own. In fact, that's what engineered whatever I'm doing today. A lady had a patient who was supposed to be amputated. Now the nurse came, Oga, what's your problem? My father, even my father, you are not the only person, you are not the first person they are going to amputate. Even my father, they amputated him. This man is not your father. Do you get it? Then, finally, strategy. What is the way forward? You are bringing solution. Okay, this is not the end. Even persons suffering with HIV, you tell this is not the end of life. You can still do this, you can still do this, you can still do this, you can still do this. Now, these are the treatment options you can follow. If your pockets, your purse cannot carry this option, this is an alternative. You can try this, you bring support and strategy. That way you would have communicated effectively. Unfortunately, most times that's not what we have. Well, I understand the work pressure our healthcare professionals are overstretched. We cannot overemphasize this. If you look at the WHO doctor-patient ratio, it's about 600. Here we are having 9,000, 6,000. In fact, our healthcare professionals, as far as I'm concerned, they are miracle workers. They are miracle workers. We blame them, but thank God we are bringing this topic, systems. Healthcare system. So it is not an isolated case of it's only the healthcare work. It's a system. So we have gotten them their challenges, but what about other areas? Thank you.
Okay, so but having talked about language barriers, medical jargons, cultural differences in communicating with patients from medical experts, would you say that these differences exposes healthcare and hospitals to legal risk?
Of course it does. Okay, there's a case of a lady who was misdiagnosed in Nigeria. She was misdiagnosed of breast cancer. They chopped off one of her breasts. Then, you see communication gap. They chopped off one of her breasts. And she was sent to another facility to continue post-surgery medication. But there's also need to have the histology reports so that they know what medication they will continue with. They couldn't provide that information because the tissue block they have gone to take told them that this lady does not have cancer or doesn't have breast cancer. There was no way to communicate, but the hospital already knew. But instead of inviting this lady to explain, sorry will not cure it though, but sorry can reduce the anger. Sorry can reduce the effects. There's a case in Benue State, Court of Appeal, Benue State, delivered that judgment. A man's child was detained in the hospital because of 2,500 naira. The man went to court. Court awarded 250 to him and still ordered the hospital to pay back the 2,005. Why? The hospital included in his list of medication a medication they did not have. The man went outside to buy. Then coming back, they handed him bill, and this particular medication, the man said, no, your hospital didn't provide this. I bought it from outside. They said, well, it is our protocol. Yes, that's our standard. You pay for it. The man said, okay, no problem. Let me go home. I will come back and pay. Let me just give me a little time. They say, if you are not paying now, we detain your child. The child was detained and the man went to court. He spent money. The court of first instance gave judgment in favor of the hospital. The man went upstairs, went to Court of Appeal. The Court of Appeal delivered judgment in his favor, awarded 250,000 and asked the hospital to refund the 2,500. How much is 2,500? Is it not communication gap? The man, there's a way you would have presented this thing to the man. Sorry, sir, this is management policy. I know it may not be okay with you, but I'm a man under authority. This is what we have been told to do. Please, that's our CMD, or that's the team lead, or that's whoever you escalate the matter, direct the person to a higher authority to speak to. The person might get there and get convinced. How much is 2,500? He will leave it. He might insist, he will get it. But he will not go up to Court of Appeal to enforce his rights. That's communication gap. There are people who have, okay, I did a case, I won't mention the hospital. A patient's son ran to me. The mother was going for dialysis, and each time they cannulate her, she loses so much blood. There was no firm plaster. Firm plaster, very strong, that adhesive that you can use and arrest blood after you have put. Saved litigation. If they had said, okay, mama, this blood, it is not as much as you really think that it is. this is it, this is it, this is it. Or next time, your son would have gotten a stronger plaster before we commence. Communication. But because of communication gap, the son took serious action. The things people complain about most times is what infuriates patients most times is attitude, not necessarily what was done. Because this example I just shared taught me firsthand. After the man listened, the CMD, after he listened to the guy's complaints, the first thing that came out of his mouth was, "We are sorry." The CMD said, "We are sorry." Madam, you needed to be there. You will see how the tension in the CMD's office just diffused because the man has apologized. So sometimes the doctors, what was done is not really that grievous. The patient, if explained to, if appealed to, if appeased, could understand. But the patient feels my ego is being bruised here. You wronged me, and on top of that, you are telling me you are a doctor, you are a nurse, I am a nobody. I will show you who I am. Even if I have no strength, I have a voice to cry. Now, the Facebook has become the cheapest court for everybody. The person will come on Facebook and start screaming, "I went to this hospital, this happened, this happened, this happened, this happened." Can you quantify the reputational damage that would have done to the hospital? You wouldn't. Now, when the person puts that information on Facebook, the next thing that will happen, people who had never gone to any hospital, people who heard stories, people who never witnessed will start saying, "Yes, that was how they killed my sister. That was how they killed my brother. That was how. Some people who might have had issues with that hospital 3-4 years ago and have forgotten it because someone had come to complain publicly now, even though that's not the proper channel, because at the end of the day, the person will not get remedy. So communication gap leads to litigation, and it costs the hospital so much. Firstly, you are going to pay a lawyer. Like the example I gave, you did High Court, you went to Court of Appeal. There are cases that have gone up to Supreme Court. You are going to pay a lawyer, 1. 2, you are going to battle with the reputation of your facility. Because people, what we have in your topic is trust and transparency. People will come to your facility when they trust you. So once trust is eroded, you just be opening and closing your shop. Because, okay, the other day someone posted on Facebook, "Please, which hospital can provide so and so service?" And people started suggesting, "Why don't you try this hospital? Why don't you try this hospital?" That is trust. Then some hospital's name will be mentioned and you hear, "No, don't go there." Do you get it? So communication is very key in patient-doctor or patient-hospital relationship. Thank you.
Okay. All right, Abuja, the phone lines are open. We would like to hear from you. Have you experienced or witnessed a medical error or near-miss incident in a healthcare facility? And what critical areas do you think there's need for improvement to ensure patient safety across healthcare facilities? The number to call 091-6333-4965. I'll take that again. 091-633-34965. Do call in. Let's hear from you. So, Barrister, I wanted us to, let's present the other side. We've talked about negligence and all, but before we get to that, let's just take a very quick break and then we'll come back. Okay, welcome back, Abuja. I have been discussing with Barrister Ebenezer, and we have been looking at the patient safety poll. Do call us. We would like to get your feedback. We want to know, have you ever experienced or witnessed a medical error or near-miss incident in a healthcare facility? And what are critical areas? What areas do you think there's a need for improvement to ensure patient safety across our healthcare facilities? So do call us 091-633-34965. I'll take that again, 091 633 34965. You can also send us a WhatsApp message 090 600 7045 090 6000 7045. Okay, back to you, sir. And I want to we've played one scenario, that's the negligence from the medical healthcare. Now let's look at it from the other angle, right? In terms of discussing, let's discuss timing, let's discuss system factors and preventability. Now, in cases where fatal outcomes occur despite medical intervention, where maybe system-related factors like delay in a person seeking care from the time they arrived, at the hospital, look at referral process. Oh, okay, you need to be referred to this particular hospital, resources available, response protocols. That could have affected, the timeliness and getting effective care. So who should be liable for poor outcomes and medical errors? Is it the personnel or the health facility?
Okay, it depends on the scenario. Firstly, talking about delay, there are three main delays that could lead to death of a patient. Firstly, is delay at home. So we don't isolate them. Delay at home. Sometimes patients present very late. Someone has a case, the person is praying. I believe so much in prayer. I am a believer in prayer and I believe in miracles. But faith is not denial of facts. Faith is that, yes, we have seen the facts, but there is a God who can override the facts and turn it. So faith is not denial of facts. When you have headache, you don't say, I am strong. You go to hospital and you get tested to know what, because headache is a symptom. Headache is not sickness. Headache is a symptom. Fever is a symptom. It's not sickness. It is when you get to the hospital and run a test, they will now know what is causing this fever. Is it malaria? Is it other ailments? So delay at home. Someone has a situation, the person doesn't go to hospital 1 week, 2 weeks, 3 weeks, 4 weeks. That's what happens most times. The person on the road, we will talk about delay on the way, on the road. The person comes in and the hospital says BID, brought him dead. And people say, no, he was still breathing, no, he was still breathing. Because there was delay at home. Second delay is delay on the road. Our roads are bad. We don't need to paint it. Do you get? Our rural interior roads. I'm not talking about Abuja road. I'm talking about, so delay on the road. Some roads are not motorable. If something happens in the middle of the night and the poor woman could not get help, a woman is in labor by 1 a.m. Now, this woman has not even registered in antenatal care because she has been told she will deliver like Hebrew women. Do you get it? I had mentioned that faith is not denial of fact. Now you are pregnant, you didn't register to antenatal care, or you even registered. Then when it was time for you to deliver, you now changed to go to traditional birth attendants as opposed to the hospital where you registered. Now a complication starts by 2 a.m. The traditional birth attendant, there is no ambulance, there is no oxygen, there is nothing there. Then there is even no vehicle to convey you to a hospital. That is delay. By the time you spend 2 hours rallying around before you get to the hospital, the woman is brought in dead. We blame the hospital. Now, institutional delay, which is the one you talked about. Delay in the hospital. Hospital protocols, sometimes go there and buy card. You go and buy. You have bought the card. Go there and confirm payments. You've gone to point B to confirm payment. Go to point C to collect receipt. What for? So, if we have emergency case, my suggestion every time has been, let us have a one-stop shop within the emergency unit for emergency cases. Now, we are not saying that you should erase institutional protocol. No, there should be need for documentation. I talked about establishing duty of care. If you didn't buy card, how will the hospital know that you are their patient? Do you get it? However, the timing needs to be breached. The timing, the delays. So if it is emergency, have a one-stop shop for emergencies. If there's emergency, all the confirmation they receive to the card, whoever is doing what, they are there. But if it is not emergency, the person can now go through the regular protocol of going to the proper points. Now, where fatality occurs due to delay, I've mentioned 3 delays so that we'll be able to isolate. I've mentioned cases of BID. People are brought in dead because the family of the victim, they are not aware of what I just discussed now. The blame is on the hospital. They don't know that they contributed by delaying at home. They don't know that the road contributed. Certain factors could have contributed on that delay on the road. Then institutional delay now. Where institutional delay leads to death, the hospital will be held liable. There's also what we call vicarious liability. Now, vicarious liability, you can sue both the facility and the personnel who caused that delay. You can sue them. Now, the personnel cannot, the hospital can also be vicariously liable for the actions of the personnel, depending whether he's an employee or a contract staff. So those are technical areas. But know that delay leading to death, the hospital is not exculpated if it is proved that they caused the delay.
All right. Okay. So we have established that data is very important, and the use of real-time data in healthcare is important to transforming patient safety, within the healthcare system. So, patient safety to receive, it's an approach whereby you're reactive in the hospital. So, reactive approach to a proactive one. We agree. So let's hear what the Chief Executive Officer of NOIPolls, Dr. Chike has to say on the importance of data towards ensuring patient safety within the healthcare system.
Data can do a lot, if we know what to look for and what to do with what we find. For example, we can track things that we can prevent. We can do something about that. We can also use the data to do some root cause analysis. Like when you identify a problem, you use the data to be able to find what exactly is the problem. That way you can provide solutions to that. Another thing is that we can't really talk about quality improvement strategies without the data that backs up what the problem is, how we intend to solve those problems, and how we can even see whether those problems are getting better. In essence, with data, what we kind of try and do is to be able to learn from the system, to understand what is going on with the system, whether it works, where the issues are, and then be able to provide solutions, and that way get the system to work for us.
Okay, so it's safe to say that real-time data can be used to proactively identify and prevent, patient harm before the adverse effect occurs.
Absolutely. If you're able to track patient movement through your facility or from each point of care, you can actually identify where there are obstacles, where the patients are having problem accessing care, or where there's issues with service delivery. That way you can do something in real time, and then you can also see as patients, as real-time data comes in, whether there are improvements to those systems. And it's really a win-win situation, because as you're seeing the data, you're solving the problem, it's going to be reflecting in the next set of numbers that you're going to be seeing. Data is really crucial if we want to improve our health system.
Okay, so still speaking about health systems, are there any safety indicators or metrics one can use to measure across institutions?
Yeah, absolutely. I think the first thing that we need to do about patient safety is to standardize the metrics that we have. That way allows you to compare across institutions. And there are so many things we can measure. You can measure patient outcomes. You can measure patient safety indicators. You can measure health outcomes. You can measure governance, as in health governance. You can measure equity. There's so many things that you can measure if you have the right data.
Lastly, before I let you go, what are your recommendations?
It's a lot, but I'm just going to try and be very specific. So I think data is crucial in improving our health systems. And as part of my recommendations, I think the first start, which we have done a lot about, is standardizing the data that we are collecting, but most importantly, have people look at the numbers and do something with the numbers. What you find is that most times people just collect data for the sake of collecting data, but nobody really interrogates the data and uses it for action. So there is importance to really stress the fact that as a manager, as a hospital administrator, or even a regulatory body, you need to have access to data, look at it, look at what the numbers are saying, and then use that to improve the system. The data use is the critical part of having data available. You need to use it to be able to make changes to the system.
In your view, what are the top 3 systematic reforms that you believe are needed what are the top 3 systematic reforms that you believe are needed to strengthen patient safety nationwide?
Okay, firstly would be capacity building, trainings and retrainings, 1. Secondly is, in fact, that ought to have been first, proper healthcare financing. Now, when we talk about health financing, it's not just passing the budget, but ensuring that that budget is implemented, it is in implementation. Then we will talk about, this is still under health financing, because believe it or not, quality healthcare is expensive. So when we do proper healthcare financing, then we now talk about capacity building, training and retraining. Then lastly will be development of institutional protocols, SOPs, checklists, because once you have a checklist, this is stage 1, do this, do this, do this, do this, do this. So the checklist automatically eliminates room for error, eliminates room for forgetfulness, eliminates room for any mistake whatsoever. So that would be my suggestion. 1, proper healthcare financing. 2, capacity building of healthcare personnel. If in healthcare finance, then even I can go beyond 3. You said 3. Then massive recruitment of qualified personnel, because where you have fewer hands, maybe 10 people doing the job of 80 people, the output will not be the same. They will be thoroughly overstretched. So that would be my recommendation.
Okay.
Thank you.
So I'd like us, before your last words, I'd just like us to quickly listen to the NOIPolls Vox Pop. So we went to the streets to get the feedback from the everyday Nigerian on their thoughts on patient safety.
How safe do you feel when you go to the hospital, and what do you see when you get to the hospital that you're confident or makes you worry about receiving care from the hospital?
On my way coming now, there is a woman went to General Hospital. When he get there, they refer her back to due on the doctor supposed to assess her. It's not unsafe, which is very bad. It's always my prayer before I get to hospital, let me be strong and healthy. Because the condition, the situation of the hospital, when you get there, when you are not strong, you give up. When you get there, they will not look after you immediately of that, what brought you to hospital. They'll refer you, buy card here, go there, buy card. You are not safe. You don't feel you are safe in that such situation. It will have been something government comes into it. They should work on it hand to hand.
Me, I have my own hospital, and with the help of God, I actually trust my doctor. Okay. So if I go there for any checkup or anything, so I will ask, this is me, maybe I'm having a headache. So with the help of God, I believe my doctor should have that good prescription of drugs that will suit what is actually happening.
But why do you trust your doctor? Why do you trust that he'll be able to? What does he do that makes you think that, oh, I trust him enough, he can attend to me?
Okay, when I had my first baby, he was the one who took the delivery, and everything went successfully. One thing my doctor does before starting anything, he prays to God, and with the help of God, I believe, and I have that trust in him, that everything or anything I want, okay, I'm secure with him.
I don't have a lot of experience about hospitals, but for the main times that I've gone to the hospital, there are some of these things I see that is not really safe, that makes me not feel safe when I go to the hospital, especially because first of all, maybe you have an emergency, you go to the hospital, they will first delay you, go and do this, go and do that, go and do that. Before they will even say, okay, let me attend to that person. Maybe you would have lost that person that have that emergency because of delayance, which is very, very bad. And secondly, our healthcare system in Nigeria, there are some prescriptions they give which is very, very bad.
Going to hospital is not a normal thing. People run away, especially at government hospital. People run away for government hospital. Government people are not doing well. Without cards, you can't treat people. Why? It's very, very bad. People are going for private hospital. Private hospital is 7 people. Why government is not helping people? Is it because of, even though it's for free, they will even tell you to buy cards. It's very, very bad.
Do you know anybody, maybe a family member, or even you yourself or a friend, a relative, who has gone to the hospital and has experienced a medical error? So maybe, for example, they gave the person a wrong prescription, they gave him a wrong drug, or they gave him a wrong injection or anything of sort?
Yes, I do. So the last baby I had was in hospital, and I managed myself to the hospital, to the toilet. So and I saw a lady talking to a friend, like she came to the hospital for a normal delivery. So at the end of the day, the nurses or matron, I don't know, forgot something in her womb, but she had to experience that pain of going to the theater for another operation.
You don't ever experience, any member of your family or maybe friend where you know, don't ever experience, say you go hospital and then they make mistake, maybe with the medicine where they give you, or as then do surgery, they make mistake, or you don't ever experience, or you know something?
No, I don't. But I heard about it. People said it, but on my member of my family, nobody have such experience.
Okay, like for instance, I've been to the hospital once with my dad, actually. Yeah, then a nurse prescribed a drugs for my dad, which the drugs is like overdose, which is not supposed to be, because he was not careful with what he is doing. Then he has to give a drugs that is not supposed to be given to him, which is very, very bad. So I think this is the little experience I've got going to the hospital. Yeah.
Okay, but when that happened, how did you people manage the situation? What was done?
Okay, when they gave him the drugs, he was not feeling very well. He was not feeling the way he's supposed to feel. He was feeling stiffy, like you understand. So they have to call the overall doctor from another place entirely to come and attend to him. So it's the other doctor that came, then gave him other supplement and all of that. Then the situation now calmed down.
So that means you couldn't report to any regulatory body, or even the hospital didn't do anything to say, oh, we are sorry about this, or people didn't sue them or anything else?
No, we doesn't sue them.
But what do you think the government can do to improve healthcare? So when people go to the hospitals, people are able to receive the proper medical attention properly?
I think we should have a qualified doctors and nurses, not that you finish from maybe this, what is it called? This normal school of nursing, and before you know it, they will start operating. Or we should have more qualities material to use on people, have more experience, go for more experience and learn more. And I believe with all those. So, and I believe with the help of the government as well, producing or providing a quality material needed. And I believe everything will be fine.
Government should pass a bill. You should make it as a bill. When as any patient went to hospital, it should be treated first. It should be treated first. Irrespective of the condition of that person, it should be attend to that person to save the life of that person before any other thing follow. And that is very, very important. And they should make sure that availability of the doctors, not the situation you get to hospital, they will be calling doctors from home. There should be a recruitment of the doctors. We get lost on ground. whereby if this one is not there, this one is there to attend to patient.
The presidents, the governors, and all of that, when they have healthcare issues, okay, they fly their families abroad to go and get that healthcare there because our healthcare system in Nigeria is not safe, which is very, very bad. So I'll beg the government to improve our healthcare system, have a good nurse, people that are people that are actually qualified for the work, not people that don't know anything about the work, and get the required equipment.
Government, you talk about free. That free, pay your workers very well. Want them to work very well, check them. Government, please wake up. Go around both in the night, morning, afternoon. Go around your government hospital, check people, check your civil servants, check your workers. Because if workers are taking care of people, you'll be saving lives.
So, Barrister, just in 30 seconds, very quickly, you've heard what Nigerians, the regular Nigerian on the streets, had to say about patient safety and their experiences. So, what are your last words?
My last words for Nigerians or esteemed listeners, firstly, get informed. In Nigeria, we have laws that protect or guarantees your rights. We have the National Health Act. There are laws that protect or provide for patients' rights there. We have the Patients' Bill of Rights. It is there. We have the Compulsory Treatment and Care for Victims of Gunshots Act 2017. So you firstly get to know your rights before you go to the hospital. Because you also have a role to play in your own safety. The body is yours. So you get to know your rights so that when the doctor or the healthcare professional is doing something you do not understand, you'll be vocal enough to ask questions from a point of knowledge, not from a point of attack. That's one. Then for our healthcare professionals, firstly, let me thank you people for all the miracles you have been doing. However, there is need for capacity building. There is need for training and retraining. Please just be humble and learn because knowledge is progressive. The more you learn, the better you get on the job. Then on the side of the government, there is need for massive recruitment so that we look at the welfare so that we reverse the brain drain because it's all this that is causing. If we have this sorted, then we'll have a better and stronger healthcare system.
Okay, thank you very much. I've been speaking with Barrister Ebenezer Igwatu, a medical lawyer and patients' rights and safety advocate. It's been a pleasure having you on Data Chat this evening.
Thank you very much. The pleasure is also mine.
All right, patient safety is not only a healthcare priority, but also a cornerstone of community development. That's the much you can take on this Data Chat session. Join us same time, same station next week Friday. Have a wonderful weekend, Abuja.